Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.
You're watching Conversations with Jennylyn, and as I continue this series on the COVID-19, I thought it would be great to interview a few people who've had the coronavirus. To date, I've had one person in Israel who had and survived the coronavirus. Clearly, he was on my show. And today, I have someone in the United States who has suffered from the coronavirus and who's also recovered. And her name is Amanda Donaldson, and she is a solar consultant in New York. And I thank you so much, Amanda, for carving out time in your busy day to join Conversations with Jennylyn. Welcome.
Thank you. I'm more than happy to be here.
Well, so you got the coronavirus.
Yes, I did.
Do you know how you got it, where you picked it up?
I have speculations, but nothing confirmed, because I actually thought I got it from my husband, but we tested at the same time, and he tested negative and I tested positive. So it's still a mystery.
But you work out in the field, or do you work from home?
I work in the field, but we were shut down since March. Well, like everywhere else in New York, we were shut down.
While you were in quarantine?
Yes, we were shut down in March. I forget exactly what date, but I got the virus in April, mid-April. So it has nothing to do with my clients, because I wasn't going out there. I was very careful, not even to go on the street. Prior to getting the virus, I went out twice to the supermarket, all decked out in my mask and gloves, and I was using sanitizers, doing everything. And twice I went to the park, same thing, social distancing with mask. So I was very, very careful. However, my husband was also taking care of his elderly uncle. So he would go out once or twice a week to check on him. And he came down with the virus.
Your husband did?
No, my husband's uncle.
Huh.
So that's why when I got it, I felt it probably came from that interaction. So I can't say for sure if my husband probably got it and didn't know. And so when they tested him, the test came back negative. I don't know. I have absolutely no idea how I got the virus.
It's weird to wrap your head around that, because even if he was asymptomatic, it would show up in his body, wouldn't it?
That's my understanding, but I don't know if the timeline has anything to do with it. If depending on when he got it and when he recovered, when it's no longer in his system. I don't know if there's a time for that, or if you will always test positive. I don't think so. I think there's a timeline. That's why when you have the virus and they need the antibodies after you've recovered, I think there's also a window where they get that from you. It's not something that's in your system all the time.
So Amanda, how long did you suffer from it? And I want to go through details as much as possible, what it felt like, how you dealt with it, but how long did it last?
The entire thing lasted, I would say, 3 to 4 weeks. Because in the beginning, having the cough, that's how it started, with the cough. I felt as if I was getting allergies, because I do suffer from allergies during the spring.
Yes.
But the difference here is that normally when I'm suffering from allergies, I'll have itchy throat, sneezing, my eyes always itch, but I didn't get that itchy feeling at all. It's just the throat felt uncomfortable, and I was sneezing a little and coughing. And I realized, no, this can't be allergies. Um, it felt more like a cold. But I was so on the alert about and worried without even realizing how worried I was about getting the virus, that when I did realize with all the symptoms, I started to get the fever. At nights, I got chills. I got headaches, diarrhea,
Wow.
everything, all the symptoms that they said
Yes.
are part of the virus, I got it.
So
And of course,
before you
sorry,
even saw a doctor, you were able to tell you had it because you were
no,
no.
I actually didn't go to a doctor. I was actually very scared because I heard so many things about you may not have the virus, but being in the environment of the hospital or the emergency room where there are people with the virus, you may be there for something else and contract the virus. So I was very adamant about not going to the hospital. I told my husband, if I cannot breathe, that's the only time should the ambulance be called for me to go to the hospital. And breathing wasn't um, a problem for me in terms of when you get a cold, you get stuffy and so forth. So that was as far as that went. But I followed all the things that people told me. I've been reading everything and listening to people who have had the virus or whatever advice, whether it made sense or not, I was listening. And one of the things I saw a video actually by two therapists from a hospital, and they were saying that just make sure that when you get the virus, you lay on your side and not your back, because your lungs are more towards your back and you want to keep your lungs clear. So all those things, as I was sick, I'm laying in bed, I tried to remember those things and was practicing them. Getting up, stretching my arms, even though you don't really feel like moving actually, but you have to will yourself. So I was doing that. I was actually getting up like every hour or 2 hours, raising my arms above my head, swinging them, walking, because I was confined to my room, walking up and down in the room, doing anything to not get worse. So those were some of the things I was following. In addition to what I was drinking, I was told you have to keep taking warm fluids, so I was doing that. I revert to my um, home remedies. So I was rubbing up with things like Vicks. I was swallowing drops of eucalyptus oil. I I was take boiling ginger. I had some turmeric powder. I cut some lemons. I boiled all that and kept it in the refrigerator. And when I needed it, I warmed it up and drank that hot. And my appetite wasn't there, so I struggled for a few days with that. But I was able to drink some soup, chicken soup. That helped. Um, but it wasn't a nice experience. And for me, it was more fear, I think.
I was going to ask you if you were
Yes.
fearful. So if you
Yeah.
didn't go to the hospital, how do you know that is what you had? Is it just based on your symptoms?
Well, based on the symptoms, I figured that's what I had. So the next step was to get tested. And there was a test being done at one of the areas here. So we signed up for the test. So my husband and I went. I was the one getting tested, but since he was there, they asked him if he wants to be tested too. So that's how he got tested. So that day when I went to get tested, I was at my worst. My fever right there was very high. I felt lethargic. I felt horrible. But I went anyway because that was the scheduled date and time for the test. And 4 days after, they called me with the results to say I was positive.
Oh, you must have been really fearful then, because now you have confirmation.
Yes,
Oh,
I got confirmation. So I continued to do what I did because all they said is isolate yourself for 14 days, which I was already doing anyway. Um, and I just continued on that. Isolated myself in my room for the next 14 days. And but I must say, when it's all it's weird because I didn't realize how fearful I was prior and during until it was over. Then I realized how relieved I was that I had it. It's weird to say that, but I actually felt relief because every day prior to that, I was reading all these things about the symptoms and what's going on in New York. Every day there's so many deaths. Every day there's so many new cases.
where
Um,
in New York do you live?
what is that?
Which part of New York are you living? In which?
I'm in I'm in Queens, and yes, we were one of the high prone areas. I was not in the because I'm in Jamaica, Queens, and it was recorded that Jamaica had a very high case of the virus. So the fear was there, and with me just following up, I guess listening more and more to the news and all this negative every day coming in about the virus. At one point, every 2 minutes, based on the numbers, every 2 minutes someone was dying. So that is scary.
Did you imagine? Were you, if
Yeah.
I were you, I would not have watched the news because I would not want to hear how many people were dying. Because my fear would be like, I'm the next statistic. I'm so proud of you that you were watching, but didn't it instill a greater level of fear the more you watched the people declining from it?
Yeah, there it was, but I didn't realize how fearful I was until it was all over, and then I felt that like a weight was lifted off my shoulder, and then I realized, well, wait, this is a feeling of relief. So I was really feeling very stressed and fearful and everything without even realizing how much of a burden that was on me during that time.
How does your husband, I would imagine your husband was taking care of you.
Well, yes, he was preparing the meals, the soup.
And they just leave it outside your door? How
They
does
will
it work?
they will come in, he will come in with a mask and bring my meals, but we only have one bathroom, so I have to share the bathroom with everybody. So what I did, I had a bottle with alcohol. So every time I use the bathroom, I sprayed down the sink, the faucet, things like that. Um, but I was in the room by myself for the most part. I mean, he had to come in and get dressed or whatever, but he would put his mask on.
What was your lowest period during this virus and this viral attack? And did you fear death at any point?
At nights.
It's worse
At
at
Yeah, because that's when I got the chills. I was really afraid to sleep because I didn't say this to anyone, but I felt that maybe I wouldn't wake up
night.
because maybe I would stop breathing.
Oh my God.
My lungs, that was my fear that my lungs would collapse or whatever. I would stop breathing and die, and I'm in the room by myself. Um, so going to sleep was not easy.
And I would imagine you're already feeling crappy and now you have to isolate. So you
Exactly.
feel like you're in prison suffering.
Yes.
Because it's sort of like that.
Exactly. You're being locked down in itself is just a weird feeling that you can't really go out as you should. And now being locked down in your room is is another extreme.
And people
So
can't come in to see you. Nobody can come in to speak to you.
No.
How did you pass the time? Did you read? Did you watch television? What do you
I,
recommend?
I watched television. I wanted to read, but I guess I was so wanting to see what's going on still. I don't know why, but I still wanted to see what's going on. So I would be watching television, or I would end up watching a movie or a comedy show just to lighten things up. But I watched a lot of television. It was a great time for me to get on with some of my planned reading, but I couldn't bring myself to read.
You
I
couldn't.
couldn't bring myself to read.
Yes.
I
Yeah.
guess I was the anxiety was there without me really realizing it.
How long would you say it lasted before you started feeling a little bit better?
For a full 2 weeks, and then I started to feel a little better with the cough the cough lasted for another 2 weeks, I would say. So the cough was, whew, it's a cough that you kind of like trying to catch your breath kind of cough.
Oh, it takes your breath away.
Yes. So you're coughing and no phlegm is coming up. That kind of cough, and you can't control it.
So
So
like you had a lot of stuff in your lungs, like when you have a really bad cold and your bronchioles become infected and you get this tightness in your chest. Did you feel any of those symptoms?
yes, I did.
Uh-huh.
And that happened especially at night. So that's why I was even more fearful, because I felt the tightness in my chest, and I'm thinking, am I getting a heart attack? Am I all these thoughts? But I kept these thoughts to myself. I didn't really tell my husband what was going on within my mind, because I don't want him to worry. Um, but these were all the thoughts going through me. But the cough was real bad. Um, what helped me with that, um, and to keep my lungs open, I did a lot of um, like steam
Mhm.
my face.
Yeah.
Like I had a bowl with hot water, or I would even go outside to the kitchen and put a bowl with water to boil and add things like ginger and so forth in there, and cover my head with a towel and inhale that steam. So I did a lot of that. Use a lot of Vicks vapor rub and eucalyptus oil and peppermint oil. So I was doing that like every hour, every 2 hours, like that,
So
to
you
keep.
are you are a healthy woman who contracted this coronavirus. Could you
Yes.
imagine people who have compromised systems, like people who suffer from asthma,
Yeah.
bronchitis? Do you feel that one of the reasons you were able to overcome it is because you had a healthy constitution to begin with?
I feel so, and sometimes we say we are healthy, but we don't know how healthy we are. Like when this is all over, I know I have to go and get a general checkup again to see, if my lungs were in any way compromised or anything like that. Because even now, there are times when I still feel that tightness of my chest, or I have a little difficulty in breathing. So I don't know what's going on. It could be something else is going on, but I'll have to have a general checkup to know what's going on. But yes, people with asthma. In fact, I lost someone I know, one of my neighbors. She had asthma, and she was taken in, and she never came back out. She
How
died.
old was this person?
Right. So
How old was she?
what is that?
How old was that person?
I think she's late 50s or early 60s. I think she's more early 60s. Yes.
I'm so sorry.
Yeah, very vibrant person, working and doing her thing, and that's it. She was here one day and gone the next. After like 2 weeks in the hospital, she was gone. So those fears, you hear so many people, young people, people the older people, I could understand, because even my husband's uncle, he's 95, and he survived. So yeah, but then you're hearing other people who are younger and they're going. So it's no one there's no guarantee that your age or your health status, because for example he is someone who has other on the other conditions, diabetes and so forth, and he survived. So there's no
Was
nothing to say. What is that?
he remain at home while he had this, or was he in the hospital?
Oh, he was in the hospital, and he actually is in a nursing rehab right now. And he has been there for over a month. So
Amazing. This
yeah,
virus, it's really interesting to see how it's impacting some people and how others are dying, you know. And I did
yes.
speak with a doctor in South Africa. I think I've spoken with many doctors treating corona patients. But I asked this doctor specifically why he thought some people were recovering and others weren't, because it's not just an age thing. He told me babies have died from it and younger people have died from it.
Hmm?
But he wasn't quite sure. He didn't have an answer for that to that question. Very
No.
sad though. So you've been recovered how long now? How long has it been since you have gotten better?
I would say now we're at the end of June. I would say 2 months probably.
Is there any chance of that you could get a relapse, or is it once you get it once, you never get it again? Do you know?
No, I understand. There are people who have gotten it again.
Are you serious?
Yes. So I still do the things I'm supposed to do when I go out. I wear my mask and everything else. I'm still very cautious. You know, I do the social. I try not to even go out. Last week I had to be in training for the entire week, and we were about 15 or so of us. So um, that's a risk that I took because it was difficult to keep your mask on
Why
for
did you
all those
guys do
hours.
it via internet? Why didn't you do it from home? Why did they make you go to the place where you were? Especially
Um,
you had the virus.
yeah, the possibly, but the way I guess that's how they wanted to do it, rather than a
Did they know
virtual
you
training.
suffered? Did they know you suffered from the virus?
Yeah, they know. They know.
Okay. I wonder
Yeah.
why they chose not to do it virtually.
I don't know. We're in sales, so I feel like when we were shut down in the beginning, we tried doing some training prior to being completely shut down, and it wasn't really successful in
Mhm.
terms of the motivation and so forth.
Got it.
I find when we're all together, it's better.
Mhm.
For me, at least, it worked out fine, except for the fact that I don't know how exposed I was for the past week.
So do you live at home alone with your husband?
And my son, who's home now.
You did a great job of quarantining that no one else in your home got it.
Right, because my son later too was tested and he tested negative.
How old is your son?
He just turned 21,
I'm
and he was always coming into my room. I had to chase him out. Get out from here, because he would come in, put a mask on, and say, "Oh, I miss my mommy," whatever. But I'm like, "No, you can't be here. You have to get out." But he's young, and I think the young people still all have the same mentality. Is like, doesn't
invincible.
matter.
I'm not getting this.
Yeah, it's like it doesn't matter. That was his attitude. So I'm glad they don't have it.
I am so happy you've recovered, Amanda, and I hope that you remain vigilant. We don't want you to get this again.
No, I
What would,
don't want to get it again either.
what would you say to especially young people who think they're invincible, they're not taking this seriously, they're thinking it's a disease for the geriatric community, they don't believe that they can be affected by it. What do you want to say to them?
I want to say to these people, please, even if most likely you will get it and be asymptomatic, because a lot of people do have the virus and not showing any symptoms.
Mhm.
But you're among people who are elderly or have compromised immune systems, and you're interacting with those people, whether that's your parents, your grandparents, uncles, aunts, whatever. So protect them, even if you may not get it into a stage where you're in the hospital or anything like that, but you are possibly affecting them. So think of them, think of your loved ones. So do the right thing.
Did you ever suffer with anything remotely close to this, or is this a very different feeling from the worst flu you've had? Because what you were describing, years ago, I visited Guyana. And as I was leaving the airport, while I was in the airport, I started with a fever. And I was on my way to Trinidad and Tobago for 2 weeks. And the entire time, I was bedridden with the dengue fever.
Oh,
And the symptoms you're describing to me sound a lot like that, although I don't remember getting a cold. All the other,
okay.
the chills, the headaches, fever, just flatlined for the
Mm,
entire time I was in Trinidad.
wow.
It was horrible because I wasn't home. So as I listened to the symptoms you described, that's what I felt like I experienced with dengue fever. This coronavirus, I'm sure you've had the flu, you've had different types of flus in the past throughout your life.
Mhm.
Are the symptoms a lot more intense than your worst flu?
Um, as a child, I suffered from lots of colds every change of season or whatever. I mean, in Guyana, we during the rainy season, whatever, I find that I got a lot of colds.
You've gone way, way down, and I can barely see you from your neck. Sorry.
Oh, sorry. Yeah, so I've had fevers and so forth, but I find this was different because I also had the diarrhea and there was some shortness of breath with that. And I think it's worse because of the unknown, because you're not sure what it is and what to expect and how your body is going to react to it. Knowing if you have a cold or a flu, in most cases, your chances of recovery are greater. A cold is a cold, you just pass on and thing. And in my younger life, anyway, um, I had no ailments at all, so I never thought of that. You get a cold, you just want it to be over as quickly as possible. But with this, I think the unknown is what made it worse. Not knowing what it will do to your body, what's next, what's gonna happen. Am I gonna be um, in a state where I can't breathe anymore and gotta go to the hospital? Am I going to be on a ventilator? Because that was a no-no for me. I'm not going on any of that. I heard too many bad reports about that. And there are also reports that how the virus is being treated in the hospital is not even correct. So I wasn't going to be part of any of that. But as to, I don't think, I've had fevers and chills and so forth before with the flu or whatever, but I think the experience in terms of your mental status in this case is the difference.
So as you're speaking, I'm thinking to myself, how brave you were. I could imagine the fear because although you didn't have confirmation that it's what you had, you were able to self-diagnose based on what's being reported as symptoms associated with this coronavirus. I can imagine how scared you were. I can't even imagine you watching the television because I don't watch it. I do this and I don't watch it. I feel it is, it can really take your peace. It can really leave you in a mindset of fear constantly, to where you're so paranoid you don't even want to live. And in terms of go to the store, buy food, and it can be crippling.
Yes.
So the fact that you had it and you were still watching what was happening to other people with the disease tells me how brave you are. Because not only are you watching it, but you're living what you're watching there. And the
Yeah.
times when you felt you couldn't breathe, I think this is my last breath. So I really applaud you that you stayed home, self-quarantine, you did all the right things, and now that now you have recovered. Having suffered from this, I'm sorry, horrible pandemic, what concerns you now with watching what is going on in your immediate environment, if anything?
Ah, well, what concerns me is people's reaction to not wearing a mask right now. Because I do feel, based on me watching and researching what really happens with when you sneeze or even just talking, the particles that come out of your mouth and how far they project into the air, the atmosphere, and how long it lingers there. You wearing a mask will protect yourself, and if you have the virus, you're going to be protecting others. So I feel people should wear their mask. I don't think wearing a gloves is important, because you can wash your hands and you can use hand sanitizers. But wearing a mask is very important. The issue that I have also is that people may not be wearing the mask correctly. I've seen people in their cars by themselves wearing a mask. Now that's crazy. That doesn't make any sense.
Wondering about that too. Like, who are you protecting against, the seats?
Right. Because your oxygen level is compromised wearing a mask.
It is.
So it's not intended for you to wear a mask all day long or for several hours. But if you're going to be in the vicinity or next to people, whether you're on the line in the supermarket, in the post office, whatever it is, then you should put your mask on, because that's a short window of time. You know, you're there for, you got to make it quick. Write a list when you go to the supermarket, get to the aisle, get what you want, and get out. So do those things with intention and quickly. So you know, if you're in the park, I see people in the park, they're exercising, they're far from each other. Pull your mask down. You don't need, get to breathe. You need to breathe. But
I don't understand it. I watch them walking down the street alone with this mask. I'm like, people just don't use their brains sometimes and just don't think, or maybe they're fearful. I don't want to judge because I don't know their motivation. But I feel like you also can take wearing the mask too far and compromise your ability to inhale fresh air. We're
exactly.
almost out of time, but when you're out and about, from what you see, are you concerned people are not taking this thing seriously still?
Yes, I am. And not just being out and about, but even on social media, like people are, I have friends who are saying that they're not wearing a mask at all. They're not, because it affects their constitutional rights and all sorts of things. So that's that that's another situation there. So I am concerned about that, because we have freedoms, but then you still have to use your judgment, and you still have to think of others, not just of yourself. People are very selfish. So you need to think of others. We're not telling you to sit in your home with a mask or go in your car with a mask. When you're in public and have to be among others, wear a mask. Take it seriously. I must commend the people though who I've seen, like in the protests and so forth, they've been wearing their masks. So I am happy for that. But in, I try to share a lot of information, any information that I get in relation to what needs to be done or how you need to react and anything that can help anybody, because this virus occurs differently in every individual. So my experience is different from someone else's.
Right.
But if there's anything that I experience that I can share, I do. I would share my experience with someone else. Maybe they're experiencing the fever, the chills, whatever. Then I can only tell you what I used. If you use it and it works, that's great. That's all I can say.
So we're out of time, but before we go, what have you learned about yourself during the?
I learned that I'm probably stronger than I thought I was.
I would imagine.
Um,
And last question, what do you want to leave with viewers or someone who has had this experience, this unpleasant experience of the corona?
I would say that you need to, even though it may add fear to your life by watching the media or whatever it is, but I think you still need to educate yourself. Whether that's looking into the studies that are going on now, or people who are in the medical field and they're giving you certain advice as to what to do. Like, for example, when I saw those two healthcare professionals who were saying what to do with to keep your lungs from being compromised. Like, they told you to tap your back, get someone to tap your back so that you can free up any blockage or anything in your lungs. So even though it might seem depressing or intimidating or whatever, you still need to pay attention to what is going on out there so that you can take care of yourself should you get sick or one of your loved ones get sick. Do not approach this through ignorance.
Amanda, thank you so much. I know you were busy and I'm grateful that you took the time. I think you are the first person that I've interviewed who has actually suffered from the corona, who has had such an in-depth, detailed discussion with me. And I am hoping people watching this, if they know someone with it, will learn something that you've shared that could help another person or maybe protect themselves.
I hope so too. I am so appreciative of you calling me and getting me on to do this. I love it. It was a great few minutes that we spent here together. Thank you so much.
You are very welcome. And thank you as always for watching Conversations with Jennylyn. When a conversation is all you need to be inspired, and in this case, inspired and educated. Learn from Amanda. She has had the experience. And if you or anyone you know is suffering from corona, please share anything that you heard here that might help them. And stay safe, and I will see you soon.